Nearly 1 in 3 adults over the age of 60 lives with a condition they cannot feel, see, or touch until it is far too late. It is known as fatty liver disease, and for decades, it was considered a condition only for those with specific lifestyle habits. Today, medical science tells us a different, more urgent story. Your liver is the body's largest internal organ, functioning as a high-speed chemical processing plant. It filters your blood, manages your energy, and breaks down toxins. When fat begins to accumulate within its cells, it doesn't just stop working. It begins a slow process of inflammation that can ripple through your entire cardiovascular system. Most people assume that if their liver was in trouble, they would feel pain in their upper abdomen. This is a dangerous misconception. The liver has no nerve endings on its surface, meaning it can suffer in silence for years while you go about your day feeling perfectly fine. In this deep dive, we are going to explore exactly how this process starts, why your age group is uniquely susceptible to the metabolic shifts that drive it, and the actionable steps you can take today to protect this vital organ. We aren't talking about fad diets or expensive supplements. We are talking about physiological adjustments that can stop, and in many cases reverse, the damage before it becomes permanent. Understanding the mechanism is the first step toward regaining control of your metabolic health. Let's look at why your liver might be storing fat even if you don't consider yourself overweight. To understand the liver, we must look at how it processes energy. Imagine your liver as a sophisticated fuel depot. Under normal conditions, it takes the nutrients from your meals and distributes them to your muscles and organs as needed. When you consume more energy than your body requires, the liver converts that excess into stored fat. This is a survival mechanism humans evolved to survive times of famine. However, in our modern world, the famine never comes. The fat keeps accumulating, and the liver becomes crowded. This condition, medically termed hepatic steatosis, is essentially the liver becoming overwhelmed by triglycerides. When these fat cells take up residence inside the liver, they disrupt its ability to regulate blood sugar. This is why fatty liver is so closely linked to insulin resistance. You see, the liver is supposed to be the master regulator of your blood glucose levels. When it is clogged with fat, it loses its sensitivity to insulin, the hormone responsible for managing sugar. As a result, your blood sugar levels start to climb, and your pancreas works double time to keep up. This creates a vicious cycle where your liver stores more fat because it cannot communicate effectively with the rest of your body. The surprising part is that this can happen to someone who appears thin on the outside, a condition doctors call TOFI, thin on the outside, fat on the inside. As we age, our metabolism naturally slows, and the way our bodies store fat changes significantly. Let's examine how these shifts happen in the body after 60. As we enter our 60s, our body composition undergoes a fundamental shift. We tend to lose muscle mass, a process known as sarcopenia, and gain a higher percentage of visceral fat. This is not just cosmetic, it is metabolic. Muscles are the primary consumers of glucose in your body. When muscle mass decreases, there are fewer sinks to absorb the sugar you eat. Consequently, the liver ends up with more work to do, processing the excess glucose and converting it into more fat. This is a key reason why fatty liver disease often emerges or accelerates in the 7th decade of life. Another factor is the change in hormonal profiles, specifically the decline in growth hormones and sex hormones, which play an underrated role in maintaining metabolic flexibility. Many people over 60 also take multiple medications for blood pressure, cholesterol, or joint pain. While these medications are necessary, the liver is the primary organ responsible for metabolizing them. Over time, the cumulative effort of processing these pharmaceutical compounds, combined with diet and reduced activity, can place a significant burden on the liver. The question is, how do you know if your liver is struggling? Since pain is not an indicator, we must look for the subtle whispers of a body under stress. These signs are often dismissed as simple aging, but they are worth paying close attention to. In the next section, we will break down the early warning signs that your liver is asking for support. If you have noticed chronic fatigue that doesn't improve with a good night's sleep, your liver might be the culprit. When your liver is preoccupied with managing fat deposits and inflammation, it is not performing its energy production duties at peak efficiency. You may also notice mild discomfort or a feeling of fullness in the upper right side of your abdomen, just below the rib cage. It is not exactly pain, but rather a sensation that something is there. Some individuals report a persistent lack of appetite or a slight nausea, particularly after consuming meals high in saturated fats or refined carbohydrates. Another subtle marker involves the skin. While skin changes can be related to many factors, persistent itching or the development of small, spider-like blood vessels on the chest and back can occasionally be linked to impaired liver function. Of course, these are not diagnostic on their own, but they are indicators that you should speak with your physician. What many seniors don't realize is that lab work often shows a fatty liver long before the patient feels anything at all. Standard blood tests, specifically those measuring liver enzymes like ALT and AST, often show slightly elevated levels, which doctors might overlook if they are not significantly high. If your doctor mentions that your enzymes are borderline, do not ignore it. That borderline status is your golden window of opportunity to take action before the liver moves from simple fatty accumulation to inflammation, a state known as NASH, or non-alcoholic steatohepatitis. This is where the real danger lies. Let's talk about the risks of leaving this condition unaddressed. When fat in the liver becomes inflamed, it begins to damage the surrounding healthy tissue. Think of it like a scar forming on your skin after a cut. If the cut is small, it heals perfectly. But if the liver stays inflamed for years, it replaces healthy, functioning tissue with scar tissue, a process called fibrosis. If this continues for a decade or more, the liver can become so scarred that it struggles to function at all. A condition called cirrhosis. The goal of this entire conversation is to prevent fibrosis from ever gaining a foothold. You have the power to stop the progression. The most effective approach is not a radical change that you will abandon in a week, but a series of small, sustainable pivots in your daily lifestyle. The first pivot is understanding the role of insulin. Insulin is a fat storage hormone. Every time you eat, your insulin levels rise. If you eat 6 times a day, your insulin levels remain elevated for most of your waking hours, giving your liver no downtime to burn its own stored fat. This is why time-restricted eating or simply reducing snacking can be so transformative. By creating a larger window where you are not eating, you allow your insulin levels to drop, signaling the liver that it is time to shift from fat storage mode to fat burning mode. It sounds simple, but the biological impact is profound. Let's delve into what this looks like on your dinner plate. When we talk about nutrition for liver health, we aren't talking about deprivation. We are talking about replacing inflammatory triggers with healing fuel. The biggest enemy of the liver is not dietary fat, but refined sugar and high fructose corn syrup. Fructose is processed almost exclusively in the liver. Unlike glucose, which can be used by every cell in your body for energy, fructose is turned directly into liver fat. You find it in soda, sweetened juices, baked goods, and many processed, low-fat snacks. Reducing these items is the single most effective dietary move you can make. Replace them with high-fiber foods. Fiber acts like a broom for your digestive system. It binds to toxins and excess fats, ensuring they are excreted rather than absorbed and processed by the liver. Think of leafy greens, cruciferous vegetables like broccoli and cauliflower, and legumes. These are not just healthy, they are liver protective. Another critical addition is healthy fats. Yes, you need fats to heal a fatty liver. Monounsaturated fats, such as those found in extra virgin olive oil, avocados, and raw nuts, can actually help reduce liver inflammation. They provide the body with stable energy that doesn't trigger a massive insulin spike. Remember, the goal is to give your liver the nutrients it needs to regenerate without the heavy load of processed sugar. It is about working with your body's chemistry, not against it. But there is another piece of the puzzle that is often left out. Movement. Let's look at how exercise changes your liver health. Physical activity is the only way to manually force your muscles to burn the glucose that would otherwise be stored in your liver. You don't need to run marathons or lift heavy weights to see results. The most effective exercise for liver health is consistent, moderate activity. A brisk 30-minute walk, especially after a meal, can significantly reduce the blood sugar spike that follows that meal. This is called postprandial glucose control. By moving, you are using your leg muscles to soak up the sugar in your bloodstream, taking the pressure off your liver to deal with it. Strength training is equally vital. As we mentioned earlier, muscle mass naturally declines after age 60. By engaging in simple resistance exercises, even using your own body weight, like chair squats or wall pushes, you are building the metabolic sinks that keep your blood sugar stable. 2 or 3 sessions of light resistance training per week can dramatically change your metabolic profile. The secret is consistency. Your liver didn't become fatty overnight, and it won't clear out overnight. It requires a steady, daily commitment to these small changes. Now, what about the common traps that many people fall into when trying to manage their health? There are several healthy habits that might actually be doing more harm than good. Let's explore these traps in the next section. One of the biggest traps is the over-reliance on supplement marketing. You will see many advertisements promising a liver detox pill or a miracle juice cleanse. From a physiological standpoint, your liver is already the most efficient detoxifier you will ever have. It doesn't need a capsule or a special tea. It needs the stress removed. Expensive supplements often lack rigorous clinical evidence and, in some cases, can even put extra strain on the liver as it tries to process the ingredients. Stick to whole foods and hydration. Water is the simplest and most effective cleanser for your liver. Being even slightly dehydrated makes the blood more concentrated, making the liver's job harder. Another common error is the weekend warrior approach. People might eat poorly all week and then try to compensate with a massive, intense workout on Saturday. This creates systemic stress and inflammation, which is the opposite of what a healing liver needs. Consistency is king. Daily, moderate movement is vastly superior to infrequent, high-intensity exertion. Furthermore, be mindful of hidden sugars in healthy salad dressings and sauces. Reading labels is your best defense. If sugar, corn syrup, or refined flour is in the first 3 ingredients, leave it on the shelf. The more you move toward a whole food, plant-forward diet, the less you have to worry about these hidden traps. Your liver will respond to these changes with remarkable resilience. But how do you know if you are making progress? Let's talk about monitoring your health and knowing when to seek professional medical intervention. Monitoring your progress is about looking at the trends rather than single data points. If you are working with your doctor to manage blood sugar or cholesterol, those numbers are your primary metrics. When your HbA1c, a measure of your average blood sugar over 3 months, starts to go down, your liver is healing. When your triglyceride levels in your blood improve, your liver is successfully releasing its stored fat. These are clear, objective indicators that your efforts are working. However, it is vital to keep your physician involved. If you are over 60, you should be having regular checkups that include a full metabolic panel. If you feel unexplained fatigue that persists, or if you notice changes in your digestion that concern you, do not wait for your annual checkup. Book an appointment. Specifically, ask your doctor about your liver enzymes and, if necessary, discuss non-invasive testing like a fibroscan or an ultrasound. These are simple, painless procedures that can give you a clear picture of your liver's condition. Knowledge is the ultimate antidote to fear. When you know what is happening inside, you are no longer guessing. You are managing. Many people are afraid to go to the doctor because they fear the bad news. But remember, in the context of liver health, early detection is synonymous with a high probability of recovery. What would you do today if you knew your health was in your own hands? We have covered a lot of ground. From the silent nature of liver fat to the crucial role of insulin, the necessity of fiber, and the transformative power of daily movement. The most important takeaway is that you are not a bystander in your own health journey. Your liver is a regenerative organ. Unlike the heart or the brain, the liver has the unique ability to regrow and repair itself, provided it is given the right environment. By reducing your intake of refined sugars, increasing your intake of leafy greens and healthy fats, and incorporating daily walks into your routine, you are changing your internal environment from one of storage to one of repair. It is not about perfection. It is about progress. Every meal that excludes high fructose corn syrup is a victory for your liver. Every 30-minute walk is a victory. These small, daily choices compound over time, leading to significant changes in your metabolic health and overall energy levels. In our next segment, we will summarize the exact daily checklist you can use to start your path to a healthier liver today. Do not underestimate the impact of these small changes on your long-term vitality. The best time to start is now, before the body has to signal its distress in more obvious ways. Let's consolidate what we have discussed into a daily framework for liver health. Start your morning with hydration. A large glass of water helps wake up your digestive system and gets your circulation moving. For breakfast, prioritize protein and fiber over refined carbohydrates. Think of eggs, Greek yogurt with berries, or oatmeal with seeds. This prevents that massive morning insulin spike. For lunch and dinner, use the plate method. Half the plate should be colorful vegetables, 1/4 lean protein, and 1/4 complex carbohydrates like sweet potatoes or quinoa. Avoid late-night snacking. Giving your liver a solid 12 to 14 hours of rest overnight is one of the most powerful hacks for metabolic health. If you are a social drinker, consider the role of alcohol. Alcohol is a direct toxin to the liver. Even moderate amounts can increase fatty accumulation in the liver because it halts the liver's ability to burn fat while it focuses on processing the alcohol. If you are serious about reversing fatty liver, a period of total abstinence is often the most effective reset you can give your liver. It allows the inflammation to subside and gives the organ the space to heal. These are not permanent punishments. They are deliberate choices to support your body's longevity. Remember, your body has an innate wisdom. When you stop overloading it, it knows exactly how to heal. As we wrap up this exploration, remember that your health is the foundation upon which your retirement and your experiences are built. Fatty liver is not a diagnosis of failure. It is a wake-up call to pay attention to your metabolism. You have more control than you think. The science is clear. Lifestyle medicine is the primary treatment. By choosing to move more, eat mindfully, and minimize the hidden sugars in our diet, you are doing more for your liver than any medication currently on the market. Take this information and use it to start a conversation with your healthcare provider. Be proactive, stay curious about your health, and above all, be patient with yourself. The body takes time to adapt, but it will adapt. Your liver is ready to heal, if you provide the conditions for it to do so. Thank you for investing this time in your well-being. By staying informed, you are already miles ahead of the majority. Take care, stay consistent, and keep prioritizing your health, because your liver and your future self will thank you for it.